Hello, my name is David Rakel. I'm here with my good friend David Kiefer, and we're with the University of Wisconsin Integrative Medicine Program, and we're talking today about gastroesophageal reflux disease. And Dave's going to start us off by talking about the status of the lower esophageal sphincter.
Thanks, Dave. A lot of us have had heartburn. A lot of us have it almost every day. It's a very common disorder. We think a lot of the problems with heartburn, a lot of the burning sensation, the chest discomfort, the bloating comes because the connection between the esophagus and the stomach isn't working well. There's a muscle there, the lower esophageal sphincter. We think that in many cases, instead of just opening slightly after we swallow, that muscle opens more often than it should, causing acid from the stomach to go up and giving us symptoms. There are many different things that cause problems with the lower esophageal sphincter. In some cases, it's a mechanical problem. There's a stretching of the muscle that happens, for instance, when people are overweight. During pregnancy, that will push on that muscle and open it slightly. If people wear tight clothes, interestingly enough, it will create more pressure in the abdominal area and cause that sphincter to open a little bit. There are other things that cause problems with that sphincter, like smoking will cause that muscle to relax. And there are numerous foods, dietary supplements even, and medications that can cause that muscle to relax. Some examples might be food-wise, food that's high in saturated fat, or even a total dietary high fat content can cause that muscle to relax a little bit. There are many things like onions, spicy foods, some of the beverages that we might drink, coffee, caffeinated coffee more likely than decaffeinated coffee, some teas, even wine or other beverages like beer can sometimes cause that to relax slightly. And then we get into a variety of spices or herbal medicines. Mint, one of the carminative herbs, as we refer them to, might cause that to relax. Anything else from your experience?
Well, that's a big one. The mints are key, that they lower that lower esophageal sphincter. But if you're going to have someone with GERD, you're trying to do some education in regards to nutrition. What are the first foods that you'll really focus on? Is it unique to them, or are there some foods that really are the most common ones?
Yeah, it's interesting. So, I will still talk to people about a high-fat diet and how that will contribute to their symptoms in most cases, and having them switch over and start to focus on fiber. It's very well known that a high-fiber diet alternatively can help that muscle work better. But some studies have shown that people with a higher BMI, who are higher on their weight, and eat high-fat foods are the ones that actually have problems with fat more than other people. So it probably is quite individual. What foods do you think about?
Well, I think of caffeine a lot, and it doesn't make sense to me because it increases sympathetic tone, right? So it should actually increase the tone, but maybe it's actually pushing, all that sympathetic tone is pushing things up.
Yeah, it could be.
So that's one I found that if we can remove is a big one, because we drink so much coffee and caffeine in our culture.
Yeah, that's right.
How about exercise? Some exercise good, some better than others?
Yeah, it's interesting. So there have been many, many studies about the connection between exercise and heartburn symptoms. People that do vigorous exercise, vigorous aerobic exercise, running, cycling, and then also heavy lifting, where there's a strong kind of abdominal component to what they're doing, probably have a worsening of their reflux symptoms. However, people that do moderate exercise and are in general more active have less reflux symptoms. So exercise overall is still a good idea as long as you don't overdo it.
Yeah. We've yet to find a disease exercise isn't good for.
Exactly.
But when you exercise, keep your glottis open. So you don't do
right.
that.
Breathe.
Right. Breathe. Health tip 101.
Breathe.
Anything else in regards, how about acid? We use a lot of drugs to suppress acid long term, but that our body uses acid to actually increase the tone of that muscle. Can you say more about that?
Yeah, that's a really good point. The body has developed a feedback mechanism such that when it detects acid, the sphincter muscle will close. So if we are chronically suppressing acid from simple things such as Tums or Maalox all the way up through our H2 blockers like ranitidine, or our proton pump inhibitors such as Prevacid and numerous other medications, that probably can decrease that feedback mechanism and cause that sphincter to be open more than it should, and may actually exacerbate heartburn over time.
Very good.